a couple of spin-offs from these observations and from these studies. Anesthesia of the deep jaw flexor tendon, because of course now we're aware that that is the most common soft tissue injury in the foot, thanks to MRI. Some of the distribution of the lesions, we talk more about that later. Now, what I want to look at is these different blocking techniques and what percentage of horses improves more than 50%. Horses with a known deep distal flexor tendon lesion. Okay? Palmar digital nerve block, about 65% of the horses improved. Coffin joint anesthesia, about 65% of the horses improved. Bursal anesthesia, about 65% of the horses improved. Abaxial sesamoid nerve block, 100% of the horses are improved. And so this is part of the reason that so many people refer horses for an MRI of the foot, because abaxial sesamoid anesthesia was 100% positive. Do not forget, though, that this also blocks out a lot of other things, especially in the fetlock ring. And so a positive abaxial sesamoid nerve block does not mean that the lesion is necessarily in the foot. Now, there's also been a lot of talk as to whether or not you can block out pain in the deep flexor tendon by blocking the digital sheath. So a statement that came out of Washington State University. Bob Schneider was a big proponent of this technique. Anything you put in the tendon sheath, he said, indicates either pain in the deep flexor tendon, or you can even treat the deep flexor tendon by injecting the tendon sheath. And indeed, SAC shows that there are some branches that come off the palmar digital nerve, enter the digital sheath, and then enter the deep flexor tendon at that level, mid-pastern. So it might be possible to block the tendon by putting local anesthetic in the sheath, but we don't have a model of tendon pain to evaluate that statement. So resolution of lameness following both abaxial sesamoid nerve block and anesthesia of the sheath might justify a suspicion of a lesion in the deep flexor tendon in the foot.